Welcome to episode 8 of First Alarm Family First. I'm Jen Herrera. Carolyn Acosta, of course, is here. And today we are really excited to be joined by Dr. Steve Kessler. Dr. Kessler, Carolyn and I have done our homework. We know a little bit about you, but can you go ahead and share a little bit about your background and what you do?
Yeah. So I'm a psychiatrist. Currently, I work part-time for the VA. I've been with them for over 10 years. Um, we've recently also opened an office in Fort Lauderdale providing psychiatric services, focusing primarily on what's called TMS, transcranial magnetic stimulation, which I'd be glad to talk to you about. Work with folks from a variety of backgrounds over the years, from um, CEOs to homeless folks, but have done a lot of work with people with dealing with trauma and depression over the years. And so I think that's a background that maybe sounds very, very relevant to what the work that you're doing and trying to highlight and provide resources for.
Amazing. Yes. So it's exactly what we're looking for. I don't know if you know a little bit of my background is my husband was a Miami-Dade Air Rescue Lieutenant who unfortunately lost his battle with PTSD 6 months ago. So I felt to honor him and to also bring more awareness to this cause is we started a foundation, First Alarm, and then we also have a podcast, which we invite guests like yourself to just kind of let us know what other treatments are out there. And we just found that TMS was something that I had never heard of, very innovative. We'd love to hear more about how anyone who is suffering with any kind of these depression, PTSD, anxiety, any disorder, how they can reach and get access to this.
Yeah. So, PTSD is something that's um, really only come to our awareness relatively recently. I think it was first in the diagnostic manual in 1980, which is not that long ago. Really came to be understood well following the Vietnam War. People mostly in the military and the VA trying to understand what people are coming back with. Although if you look back, people have suffered from post-traumatic stress since we've had trauma as humans. After the Civil War, people after the Civil War had what they called soldier's heart. It was primarily like cardiac kinds of symptoms. After World War One, shell shock, right? Um, and we didn't really talk about it a lot after World War II, I don't think. But it became so prominent, so many people suffering after Vietnam. So we started to come to understand it in the 70s and 80s. The treatments over the years have primarily been therapy and medications. Um, Therapy is often helpful, but difficult. People have to talk about traumatic stuff that happened to them, and that's hard to do. Um,
Yeah.
Medications are very helpful. I've had many people who've benefited from medicines, but not everyone. And some people have trouble tolerating medicine side effects. So the development of these new treatments is very exciting for me and many in our field because it's an alternative approaches to help folks with these kinds of problems. Um, One of the issues with medications is it treats, you can't tell a pill to just go where you want it to go. It affects your entire body. So that's what we call them side effects. The medicine doesn't know it's a side effect, it's just an effect. So if it affects your gut, that's what the medicine knows to do because it's going to affect all of you. Uh, TMS is a treatment which is very localized. So we were able to use a magnet to stimulate particular parts of the brain that we know are affected in certain conditions. So, for instance, people with depression seem to have an underactive part of the frontal lobe of the brain. If we provide very focal stimulation using the magnet to that area of the brain, it causes those nerve cells to grow and connect better to other parts of the brain, and kind of brings them back online. So again, instead of treating the entire body, we're focusing treatment on a very particular part of the brain that we know is involved in these conditions. So right now, TMS is approved for treatment of depression and obsessive compulsive disorder, also for smoking cessation in America. In Europe, it's also approved for treating other conditions like addictions. And I'm hopeful that these other kinds of problems will also get approval here in the US for treatment. But we can treat anyone um, with the TMS device. But the only limitation is your insurance will pay for it. It'll pay for the conditions that FDA approves it for at this point. But it is an FDA approved condition, and insurance does pay for those approved conditions, which is great.
Dr. Kessler, how does it work? Can somebody call the NeuroHealth Treatment Center, head to your office in Fort Lauderdale, and just walk in and sign up for a session? Do they have to have seen a traditional doctor therapist beforehand? Are there a certain amount of sessions? I believe there are. How does that whole thing
Yeah.
work?
So typically insurance will not pay unless you've tried other treatments like medications first and they have not worked. And I think that's because TMS is a more expensive treatment. So they want you to try those other things first. And if they don't work, then they'll say, okay, go ahead and do this. So when someone comes and calls, I'll see them, do an evaluation, spend time to understand what's going on, look at previous treatments and see if they're an appropriate candidate. If they are, we contact their insurance company, and if all is approved, we go for it. TMS typically is a series of treatments. They're very brief. When this was first approved back in 2008, typical treatment was 37 minutes. Over time, we figured out how to make it much briefer. It can be as brief as 3 minutes and 19 seconds now.
Wow.
So you come in, get the treatment, and you go. There's no anesthesia. You're fine to just go about your day. But it's a repeated number of treatments. So typically with depression, it's around 30, 35 treatments. People come in daily, 5 days a week, for a month and a half.
Doctor, do they feel anything when they're getting the treatment?
So the magnet itself, because we want, the target is the brain cells underneath the skull, but there are things over your skull. There's skin, there's nerves.
Okay.
So the magnet will stimulate those things, and there may be a slight discomfort as we stimulate the nerve cells that are just superficially on the scalp. So people may feel a slight tenseness of those muscles. Sometimes there's a headache. There might be like a twitching sensation, but that's about it. So it's generally well tolerated. There's nothing that a Tylenol that doesn't help.
Doctor, why do you think for first responders and veterans specifically, TMS is gaining popularity?
Well, I think a lot of people don't like taking medicines, or they've had negative experiences with medicines, and so I think a lot of folks are looking for alternative ways to help them get better. And this is, I think, a very viable one for a lot of folks.
You mentioned having to have seen a doctor or been prescribed medications in order for your insurance to cover the treatment. If somebody is watching and they are willing and able to pay out of pocket, are those prerequisites necessary, or can they just come in for treatment?
They can definitely just come in for treatment. If someone is opposed to medications and they don't mind paying for it, we're happy to provide the treatment. Yeah.
As far as who's someone who has been in the field, this field, as long as you have been, what is it? I mean, what is your reaction to this option for patients who are truly struggling when it comes to their mental health?
To me, this is really a revolutionary change. When I started as a medical student and resident, this wasn't even a possibility. Like MRIs were just coming out. It was just um, in the 80s and 90s when we had PET scans, when we began to be able to look at brains and understand what happens in these conditions, and to truly get a sense of where in the brain are problems happening. And then to have this next leap of being able to provide a treatment specifically to those parts of the brain. It really is a revolutionary change in the practice of psychiatry. I can't overestimate how exciting this is for us.
How long would a patient typically start seeing results, would you say?
So it varies. Some people may feel better within a few treatments. For other people, it seems to lag. And on average, it takes about 20 sessions before people really start to notice a difference. There are some people may not notice it till they've completed the entire series of 36 treatments. Not sure why that variability is, but that does exist. And of course, we can't guarantee that every person is going to get better with TMS, but the results are really very high, particularly with depression, but also for anxiety and PTSD. Um, Nothing's 100%, unfortunately. One of the things about there are a variety of TMS machines out there. Ours was developed based on the use of MRI to target treatment. And it really is the only company that has developed their TMS machine around that. So our ability to very precisely localize treatment really makes it much more likely that we're going to hit the right place in your brain. So we really feel like we've gotten the best possible device for treating these conditions.
With that said, doctor, I know of another place in Central Florida that does TMS. You guys, NeuroHealthTreatment Center in Fort Lauderdale. There aren't a ton of offices offering this. Is it because the machine is so expensive? Is it because it's newer? Any idea as to why?
It is relatively new. It's that being said, it was approved in 2008. It does take a while before people learn and understand of new treatment options, and it just takes a while for it to get into public awareness, even. And until there's the demand, we're not going to provide it, right?
Right.
So yeah, it's unfortunate that it's been almost 20 years now, and a lot of people don't even know it exists. So I'm really glad that you folks are doing this podcast and giving us the opportunity to help spread the word and help people understand that this treatment's available.
That's amazing. Do you guys treat children as well, or is it just strictly for adults?
We are only treating adults. There have been research trials in kids, but so far it's not had an approval for kids. There recently was an approval for adolescents, so that I think is coming.
Okay.
Yeah, interesting. Um, without violating anybody's privacy, the reaction that some of your patients are having for those who have been successful. Can you kind of share with us what some of those reactions have been, post a certain amount of treatments and them coming out on the other side of this?
So one particular person comes to mind, a person later in life who had treatment for depression for 40, 50 years until finally got TMS, and it was the first thing that helped relieve the depression after all those decades. It, people really describe it as kind of a miracle to finally feel better. It really is an amazing thing.
Doctor, forgive my ignorance. I know that you talked about like the magnet and the brain and you're under the machine. And I believe watching some of your videos on social media, it's similar to like locating like a tumor, like being able to locate the affected area, if you will. How does that work? How is that done?
So to use our particular machine, you have to get an MRI. So we load the MRI into our machine. We can see your brain up on our machine, and it very specifically shows us the area that we know is involved in particular conditions like depression. And the magnet very specifically, once we place it over that area, only stimulates that area.
It's fascinating.
It is.
Yeah.
So let's say I was a patient going in there and I qualify for this treatment. And let's say I'll do it for 15 days. It's 15 consecutive days that I would go in for the treatment.
Well, we usually don't do it on the weekend, so it's usually 5 days a
Okay.
week.
Okay.
And yeah, so daily, otherwise, yes.
Okay. And how would you know what, like, would I just log sleep patterns? I'm just feeling less anxious. How would we gauge that for progress?
Yeah, so typically I will meet with folks through the course of the treatments. We have certain kind of standardized questionnaires around depression and anxiety that we'll have folks do to try to gauge whether we're seeing changes. That anxiety is better, there's less depression, more ability to enjoy life or gain a sense of pleasure and activities, those kinds of things. Let me mention there's another protocol other than coming in every day for a month. So folks out in Stanford decided, well, why do it over the course of 6 weeks? Why don't we try to squeeze all the treatments into a week? And so there's a Stanford protocol where people are coming in and doing 10 treatments a day for a week. They're getting 50 treatments.
Wow.
And the results are quite amazing. Now, it's a big commitment. So that's 10 hours a day.
Yeah.
The results are phenomenal. Like within a week, people's depression is like gone. That's hard for most people to do. So we're doing sort of a variation of that for folks. So we might do 3 or 4 treatments a day for a couple of weeks, but still much more rapid. It has gotten approval from the FDA. So I'm not sure whether all the insurances are paying for that yet. But this is pretty new and a very exciting development as a way of getting it much more rapidly.
I know you said it's pretty new, so time will tell, but with those rapid sessions, for instance, and even for the sessions that you guys are doing, does the depression stay gone or is like as a tune-up necessary every once in a while, or does it stay away?
Yes, good question. So some people, it seems like one and done and you're fine. Other folks may notice that the depression comes back after a number of months and can come back and, like you said, get a tune-up, maybe come in and get a few sessions and try to get back on track.
Interesting. Doctor, do you offer any other treatments besides TME there?
So I do traditional psychiatric treatments as well. There's also a treatment called Spravato,
Mm-hmm.
which
Yeah.
is also relatively new. It's approved for treatment-resistant depression as well, and it is a variation on ketamine. It's S-ketamine. It's a
Mm-hmm.
nasal spray.
Yeah.
So some people may be familiar with ketamine. It's actually originally approved as a anesthetic, but
Mm-hmm.
it's known to have some sort of mild psychedelic properties. Um,
Mm-hmm.
and it's studied for a number of years now, actually probably going on 15, 20 years as well, as a treatment for depression. Um, for folks who have not done well with traditional medicines, they may respond very powerfully to this kind of medicine. It's a very different treatment for depression. It's totally different than any of the antidepressants that have been around.
Absolutely. Yeah. And it's
So
a
that
nasal spray.
it's a nasal spray. So folks have to come into the office. It's initially twice a week for a month, and then we may cut it down to like once a week after that, and kind of taper down over
Mm-hmm.
time. So it's another alternative treatment that, again, many folks may have never tried before and may be very effective.
Mm-hmm.
This is all just so cool. And I love that we're able to, Carolyn, to share other options with people.
I love it. I love the whole innovative, different, more holistic approach because a lot of people are hesitant to take medication and, it's nice to give them options.
Absolutely, yeah. People need to know what's available and then kind of decide what might make sense for them, um, based on their own history and what they've tried or what makes sense to them. So that's what we want to kind of give them those options.
I just want to make this point before we go. Just being two moms up here, and I saw this as well on your social media because of its non-invasive nature. A woman, for instance, doctor suffering postpartum depression, it's
Mhm.
it's safe, right? Even for a nursing mom.
Well, exactly. So unlike uh, medications, which you have to worry about, is it going to affect my baby, or is it going to, will the medicine be in my breast milk?
Right.
Having a treatment like this, you don't have to have those worries. So it definitely is an option for someone who's pregnant or postpartum. Sure.
Yeah, that could help a whole lot of women. Doctor, where do people find you guys? How do they make an appointment?
Okay, so we are in downtown Fort Lauderdale on East Broward. Um, Actually, I don't have my phone number right in front of me. Let me make sure. Let me make sure. Hold on. I'm going to pull it up on my phone.
Take your time. We've got 4 minutes.
You have a great Instagram page as well with a lot of informative videos
Yeah.
I was watching
Yes.
earlier. So.
Yeah. So NeuroHealthTreatment.com is the website. If you call us 954-417-7575, or go to the website, let us know that you're interested. Give us a call if you just want to talk and learn more about it. Come in and talk to us.
You have an amazing team there as well. Dr. Kessler, thanks so much for being with us.
Yes.
Thanks for giving me the opportunity. Anytime.
Thank you. Take care.
Here.
You too.
Bye.